Fox 5 has also been following the safety of your tap water for years, and tonight there are new concerns. An environmental group says your tap water could be toxic, in fact downright dangerous if you're pregnant. But the experts argue the water flowing through Arlington Falls Church and the district is fine. Fox 5's Ellen Chang is sorting out the facts. She joins us now to explain. Ellen?
Sean, part of that response has to do with the fact that currently there are no compliance problems. Public policy experts we talked to say it's a lot of hype over unscientific testing, but the group behind the report says thinking outside the box yields a more accurate picture. Jeannie Simpson has no problem washing the dishes with tap from her Northwest home, but drinking it is an entirely different story.
I'm not drinking the DC water.
Simpson's home was one of 18 locations where the Environmental Working Group collected water samples. The result? As much as 40% of the samples tested turned up toxic byproducts of chlorine. And now the organization says pregnant women should be worried.
Those risks don't occur over the course of a year. They occur over the course of a pregnancy, which is much less than a year. So these spikes where women could be drinking water with elevated levels of these toxic contaminants for months at a time do present real risk to their babies.
Not so fast, according to public policy expert Angela Logomasini.
The risk to these disinfectant byproducts is low. It's based on associations, not demonstrated causal impacts.
Logomasini says the findings of the Environmental Working Group are unsubstantiated hype. She argues the group's report distorts the reality of low-level chemicals and undermines the value of chlorine, a chemical disinfectant.
Picking out a few days where it's high and saying it's a danger is just completely wrong, and it goes against EPA's regulatory standards, and it's not scientific.
Logomasini adds it's long-term exposure that matters. The Environmental Working Group confirms it collected samples over a few days, but says that was enough to get an accurate estimate on chlorine content.
We use an accredited lab, a lab accredited by the U.S. EPA, and actually we tested twice as many places as the water utility test.
Back in Northwest, Jeannie Simpson knows exactly where she stands.
Is there a need to hide it? Is there a need not to tell us? I would say we should know if we want to know. I want to know as a pregnant person.
Our public policy expert Angela Logomasini adds part of the concern is fallout from what she's describing as hype. She says similar concerns over chlorine in South America, for example, have led to movements where it's been completely eliminated. And in some cases, she says that vacuum of chlorine